My name's Klein. I'm a physician working at the Montreal Chest Institute here in Montreal, and I'm a clinical researcher. And I've been involved in doing clinical research in the area of HIV, and particularly in HIV and hepatitis C co-infection for a number of years. And I've been an active investigator in the Canadian HIV Trials Network. One of the success stories has been that we have very good treatment for HIV now. And what that means is that some of the other problems that persons who are infected with HIV are facing, particularly co-infections with viral hepatitis and hepatitis C in particular, have emerged as a major problem for people living with HIV. Although we can treat HIV well, we haven't slowed the rates of hepatitis C progression. We're starting to have some really exciting treatment options with respect to hepatitis C, with a lot of new drugs being developed, but as always, things are slower to be tested in the setting of HIV infection because of concerns about how people will tolerate those drugs, what are the drug interactions, and so forth. So we're very interested in developing new strategies to treat people who have both infections so that they can benefit from all the advances that are being made for hepatitis C generally around the world. This is a study that is now approved to go forward. We're going to have 4 sites within Canada, one of them which is based here. It's what's called a pilot study because at the moment we don't even know how often we can measure changes in fibrosis using a special type of scan called a Fibroscan, which measures liver stiffness. And so what we want to get an idea of is how fast changes can be seen. So we're going to recruit 40 patients across Canada who are already taking antiretroviral treatments that include a protease inhibitor boosted with ritonavir. And the reason we've selected that is because we think that it might be more toxic to the liver over the long term and might contribute to fibrosis. And so we're going to randomly assign people to stay on their treatment or switch to this new drug called Raltegravir, which is open and licensed currently in Canada, but looks like it's more friendly in terms of liver side effects and metabolic side effects. And then we're going to follow people over the course of actually 1 year after they make this switch to see if there's changes in the level of fibrosis in their liver using what we call a non-invasive way to measure liver fibrosis, and that's this special ultrasound called a Fibroscan. I think it's an important first study because we have treatment options like hepatitis C treatment, which can really change hepatitis C disease, but a lot of people who have co-infection can't tolerate those treatments because they're really toxic or difficult, or they've already tried those treatments and they haven't worked for them. And so we need some other ways of managing and slowing fibrosis in this population.